Hi, welcome to another episode of Catch This. My name is Trudy Ray, and today I would like to talk about another SARS-CoV-2 vaccine. This is the vaccine that was developed by Oxford University's Jenner Institute in collaboration with the pharmaceutical company AstraZeneca. The vaccine candidate consists of an adenovirus vector with an inserted gene that encodes the full-length SARS-CoV-2 spike protein. As I explained in my previous video, linked here, the SARS-CoV-2 spike protein has been the primary antigenic choice for a number of SARS-CoV-2 vaccine candidates because it is highly immunogenic. The idea of using a virus as a vector to deliver vaccines to humans is a pretty established idea, and it is based on the ability of viruses to enter cells by attaching to host cell receptors and releasing their genome into the cell. Once this vaccine is injected into a vaccine recipient, the vaccine vector should enter cells and serve as a code for host proteins to make the SARS-CoV-2 spike protein from the inserted gene. Ideally, the spike protein will then act as an antigen to prime the immune system to recognize SARS-CoV-2 if it infects the body at a later time. Adenoviruses are particularly suitable as vectors for delivering foreign genes into cells because they have a double-stranded DNA genome that can accommodate large segments of foreign DNA, and because they infect most cell types without integrating into the host genome. However, due to the prevalence of adenovirus infections in humans, most people already have adenovirus-specific antibodies that could bind and neutralize the vector itself, and this could make it less effective at stimulating antibodies to the foreign gene product. To get around this problem, the Oxford AstraZeneca investigators used an adenovirus of chimpanzee origin that does not normally infect humans. So, recipients of this vaccine vector would not likely have pre-existing antibodies to the adenovirus vector itself. This is why the Oxford AstraZeneca vaccine vector shell is called ChAdOx1. The Ch stands for chimpanzee, the Ad stands for adenovirus, and the Ox stands for University of Oxford. Oxford has developed more than one adenovirus-vectored vaccine, meaning that they had to number them. So this is where the 1 comes from. I assume it was the first to be made. Okay, so now we have this chimp adenovirus with the inserted SARS-CoV-2 spike gene, but we can't just inject that into people. The researchers further optimized the virus by deleting 2 genes. They deleted a first gene, which regulates viral replication, and this ensured that the chimp adenovirus cannot cause an infection in human cells. They also deleted a second gene, which created more space inside the vector for the inserted gene. Earlier this year, Oxford and AstraZeneca completed a combined phase 1/2 clinical trial to test this vaccine. Phase 1 clinical trials typically involve a small group of patients, and they aim to identify which dose of a new drug produces optimal outcomes with the fewest side effects. This phase usually only involves a very small group of participants, like 50 or 30 people. Phase 2 clinical trials further assess safety as well as whether or not the drug or vaccine actually works. That is, its efficacy, and this usually involves a larger group of people. In times of emergency, phases of a clinical trial are often combined to save time, which is what was done here. I briefly also want to mention that the ideal clinical trial is prospective, randomized, controlled, and preferably double-blinded, using a large number of patients or a large sample size. Prospective means that it looks forward to future results and is in contrast to a retrospective study, which looks back at events that have already happened. In a prospective study, you can plan and control for various factors that I'm about to describe, while in a retrospective analysis, everything has already happened, so you can't apply those proper controls. Okay, so what are those factors that you can control? Randomized means that participants are randomly assigned to the experimental or control group, so that the only expected difference between the experimental and control groups will be the outcome variable that is studied. This eliminates unwanted effects that have nothing to do with the variable being analyzed. Double-blinded means that neither the investigators nor the subjects know who is receiving a particular treatment. This leads to more authentic conclusions because they reduce researcher bias. Large sample size is important for determining whether results are statistically significant. So this combined Phase 1/2 trial for the Oxford-AstraZeneca SARS-CoV-2 vaccine enrolled 1,077 healthy adult volunteers aged 18 to 55 who were randomly assigned to receive the experimental SARS-CoV-2 vaccine or a control vaccine. The trial was single-blinded, meaning that only investigators knew whether any particular subject received the experimental or the control vaccine, while the subject did not know. The control vaccine was a licensed vaccine against meningitis and was not viral vector-based, like the SARS-CoV-2 vaccine. The investigators chose the meningitis vaccine as a control to ensure that subjects remained blinded to which treatment they were receiving, because, like some vaccines, the meningitis vaccine causes a slight reaction. They did this because it is likely that if someone received a saline control instead and didn't have a reaction, they would know that they received the control, and that would create a subjective bias and possibly affect experimental outcomes. If you want more detail about the results of the Phase 1/2 trial, I recommend my blog post at Virology Blog, which I published on July 23rd. Today, I want to talk about the interim results of the Phase 2/3 clinical trial for this same vaccine. A Phase 3 trial involves many more, like thousands of participants, with a range of different ages and ethnic backgrounds from different countries. This phase is meant to further demonstrate safety and effectiveness. Effectiveness refers to whether a vaccine or drug actually works in real-world conditions, in contrast to efficacy, which is performance under ideal and controlled circumstances. The results of this Phase 2/3 trial were published in The Lancet on December 8th. This trial was also a randomized, controlled, single-blinded study, like the Phase 1/2 trial, using the same meningitis vaccine as a control. And these people received 2 doses of the vaccine at various time intervals, ranging from 1 to 3 months, and these differences in time intervals between the first and second dose were due to logistical issues. But that is okay, because it allows us to see results in real-world conditions, when not everybody makes it back for the second dose at precisely 4 weeks. The 2 doses were both supposed to be full doses of 50 billion viral particles each dose. However, somebody made a mistake in the UK trial, and a subset of the participants only received a half dose for their first injection, and then they received the full dose for the second or booster injection. AstraZeneca received a lot of criticism for making this mistake, but I have to give them credit for being transparent about it and reporting it. Not only that, but the mistake actually revealed something very valuable, and that is that the low dose followed by a full dose regimen actually results in better efficacy, about 90% compared to 62% in people who received 2 full doses. There were 10 people hospitalized for COVID-19, and all of them were in the control group. None of them were people who received the SARS-CoV-2 vaccine. Overall, the vaccine was well tolerated. I do want to mention that any adverse event observed in a clinical trial after vaccination has to be reported. There are very strict standards in place for this, and that can include any event. For example, if somebody dies from homicide a week after being vaccinated, that gets reported, even though the death had nothing to do with the vaccination. And that actually did happen in this trial. There were 4 deaths that were not related to vaccination or COVID-19, with one of them being a homicide, and the others were a traffic accident, blunt force trauma, and fungal pneumonia. So far, the clinical trial results for the Moderna, Pfizer, and AstraZeneca vaccines are reassuring. Considering the number of people in this world, the more vaccine options we have, the better, in my view. I can't wait to get mine. and I will make a video about it. Stay tuned. My name is Trudy Ray. I'll see you next time on Catch This.